Subscribe for daily quizzes and let me know how many you got correct today. Here's some metabolic disorders trivia. What genetic disorder affects the metabolism of phenylalanine? A. Aspartame intolerance, or B. Maple syrup urine, or C. Phenylketonuria, or D. Galactosemia? The correct answer is C. Phenylketonuria. Which metabolic disease is caused by a deficiency in hexosaminidase A? A. Tay-Sachs disease, or B. Pompe disease, or C. Fabry disease, or D. Gaucher disease? The correct answer is A. Tay-Sachs disease. What is the metabolic disorder caused by an inability to oxidize very long-chain fatty acids? A. Maple syrup urine, or B. Carnitine deficiency, or C. Galactosemia, or D. VLCAD deficiency? The correct answer is D. VLCAD deficiency. What inherited disorder affects iron metabolism? A. Hemochromatosis, or B. Cystic fibrosis, or C. Sickle cell disease, or D. Tay-Sachs disease? The correct answer is A. Hemochromatosis. Which disorder involves the deficiency of the enzyme galactose 1-phosphate uridyl A. Galactosemia, or B. Lysosomal storage disease, or C. Phenylketonuria, or D. Maple syrup urine disease? The correct answer is A. Galactosemia. Which disorder is characterized by an inability to metabolize branched-chain amino acids? A. Homocystinuria, or B. Maple syrup urine disease, or C. Phenylketonuria, or D. Cystinosis? The correct answer is B. Maple syrup urine disease. Which metabolic condition is characterized by inflammation of the pancreas? A. Pancreatitis, or B. Liver cirrhosis, or C. Diabetes mellitus, or D. Hemophilia B? The correct answer is A. Pancreatitis. What disorder arises from the absence of glucose 6-phosphate dehydrogenase? A. G6PD deficiency, or B. Fructose intolerance, or C. Lactose deficiency, or D. Galactosemia? The correct answer is A. G6PD deficiency. Which genetic disorder is due to a deficiency of the HPRT enzyme? A. Lesch-Nyhan syndrome, or B. Wilson's disease, or C. Cystic fibrosis, or D. Albinism? The correct answer is A. Lesch-Nyhan syndrome. Which metabolic disorder leads to kidney stone formation? A. Diabetes mellitus, or B. oxalosis, or C. Gout, or D. cystinuria? The correct answer is D. cystinuria. What is the name of the disorder characterized by an impaired ability to metabolize copper? A. Celiac disease, or B. Wilson's disease, or C. Hemochromatosis, or D. Menkes syndrome? The correct answer is B. Wilson's disease. What metabolic disorder is linked to an inability to process fructose? A. Fructose intolerance, or B. Lactose intolerance, or C. Phenylketonuria, or D. Galactosemia? The correct answer is A. Fructose intolerance. What disorder arises from a defect in mitochondrial fatty acid oxidation? A. Wilson's disease, or B. Galactosemia, or C. Medium-chain acyl-CoA dehydrogenase deficiency, or D. Pompe disease? The correct answer is C. Medium-chain acyl-CoA dehydrogenase deficiency. Which disease is caused by an accumulation of lysosomes due to enzyme deficiency? Tay-Sachs disease, or B. Gaucher disease, or C. Fabry disease, or D. Wilson's disease? The correct answer is C. Fabry disease. Which metabolic disorder is related to abnormalities in neurotransmitter metabolism? A. Phenylketonuria, or B. Tay-Sachs disease, or C. Homocystinuria, or D. Maple syrup urine? The correct answer is C, homocystinuria. What condition is marked by extreme fatigue, muscle weakness, and exercise intolerance? A. Myocardial disease, or B. Fibromyalgia, or C. Chronic fatigue syndrome, or D. Iron deficiency anemia. The correct answer is A. Myocardial disease. Which condition relates to impaired absorption of vitamin D and calcium? A. Osteomalacia, or B. Osteoporosis, or C. Hypophosphatemic rickets, or D. Celiac disease. The correct answer is C. Hypophosphatemic rickets. Which rare disorder is due to a deficiency of the enzyme porphobilinogen deaminase? A. Hemolytic anemia, or B. Wilson's disease, or C. Acute intermittent porphyria, or D. Cystic fibrosis. The correct answer is C. Acute intermittent porphyria. What disease results in fatty liver and insulin resistance? A. Alcoholic liver disease, or B. Hemochromatosis, or C. Non-alcoholic fatty liver disease, or D. Type 1 diabetes. The correct answer is C. Non-alcoholic fatty liver disease. Which syndrome is characterized by the overproduction of catecholamines? A. Cushing's syndrome, or B. Pheochromocytoma, or C. Addison's disease, or D. Acromegaly. The correct answer is B. Pheochromocytoma. Which genetic abnormality prevents normal breakdown of proteins? A. Sickle cell anemia, or B. Down syndrome, or C. Tyrosinemia, or D. Cystic fibrosis. The correct answer is C. Tyrosinemia. What condition is caused by defects in the peroxisome? A. Cystic fibrosis, or B. Tay-Sachs disease, or C. Zellweger syndrome, or D. Down syndrome. The correct answer is C. Zellweger syndrome. Which disorder affects the breakdown of very long-chain fatty acids? A. Carnitine deficiency, or B. Phenylketonuria, or C. X-linked adrenoleukodystrophy, or D. Gaucher disease. The correct answer is C. X-linked adrenoleukodystrophy. What failure of carbohydrate metabolism leads to severe hypoglycemia? A. Fructose intolerance, or B. galactosemia, or C. von Gierke disease, or D. Tay-Sachs disease. The correct answer is C. Von Gierke disease. What disease is associated with the accumulation of tryptophan metabolites? A. Alkaptonuria, or B. Hartnup disorder, or C. Phenylketonuria, or D. Maple syrup urine. The correct answer is B. Hartnup disorder. Which metabolic disorder is marked by low levels of serotonin? A. Maple syrup urine disease, or B. Phenylketonuria, or C. Tryptophan hydroxylase deficiency, or D. Galactosemia. The correct answer is C. Tryptophan hydroxylase deficiency. Which disease causes an inability to metabolize the amino acid arginine? A. Maple syrup urine disease, or phenylketonuria, or C. Urea cycle disorder, or D. arginase deficiency. The correct answer is D. arginase deficiency. Which metabolic disorder is associated with unique brittleness of bones? Osteogenesis imperfecta, or scurvy, or C. rickets, or gout. The correct answer is A. Osteogenesis imperfecta. What disorder arises due to a deficiency of the enzyme glucocerebrosidase? A. Fabry disease, or B. Gaucher disease, or C. Tay-Sachs disease, or D. Pompe disease. The correct answer is B. Gaucher disease. Which condition is a result of mitochondrial dysfunction? A. Type 2 diabetes, or B. Cystic fibrosis, or C. Lee syndrome, or D. Multiple sclerosis. The correct answer is C. Lee syndrome. What disorder is associated with excess ammonia in the blood? A. Hyperammonemia, or B. Cirrhosis, or C. Hepatitis, or D. Liver cancer. The correct answer is A. Hyperammonemia. Which disease results from a mutation in the glucose transporter? A. GLUT1 deficiency, or B. Type 1 diabetes, or C. Cystic fibrosis, or D. Sickle cell anemia. The correct answer is A. GLUT1 deficiency. Which inherited disorder affects lipid metabolism with accumulation of sphingomyelin? A. Niemann-Pick disease, or B. Fabry disease, or C. Gaucher disease, or D. Tay-Sachs disease. The correct answer is A. Niemann-Pick disease. What metabolic disorder can cause kidney stone formation due to high oxalate? A. Cystic fibrosis, or B. Diabetes mellitus, or C. Primary hyperoxaluria, or D. Wilson's disease. The correct answer is C. Primary hyperoxaluria. Which disorder leads to hyperglycemia due to glucagon overproduction? A. Addison's disease, or B. glucagonoma, or C. Cushing's syndrome, or D. Diabetes mellitus. The correct answer is B. Glucagonoma. What is the name for disorders caused by defects in fatty acid oxidation? A. Energy production defects, or B. Metabolic pathway disorders, C. Fatty acid oxidation disorders, or D. Lipid metabolism issues. The correct answer is C. Fatty acid oxidation disorders. Which rare metabolic disorder involves deficiency of lysosomal enzymes? A. Glycogen storage disease, or B. Cystic fibrosis, or C. Phenylketonuria, or D. Mucopolysaccharidosis. The correct answer is D. Mucopolysaccharidosis. What is the disorder characterized by impaired iron absorption? A. Iron refractory iron deficiency anemia, or B. Anemia of chronic disease, or C. Sideroblastic anemia, or D. Folate deficiency anemia. The correct answer is A. Iron refractory iron deficiency anemia. Thanks for watching. Comment with how many questions you got correct. Should we make the next video have easier or harder problems? Was the difficulty just right? Do you have suggestions for future trivia topics? Don't forget to drop a like and sub if you enjoyed the video.